members of the European Parliament, ladies and gentlemen, distinguished guests. First of all, my sincere thanks for this invitation on behalf of the European Commission to be here with you to speak at this European Summit on the prevention and self-management of airway diseases. I would like to take this opportunity, first of all, to share with you our work, which is very much focused on how we can contribute to reduce Europe's burden from chronic, non-communicable diseases, including, of course, airway diseases. We are all very aware that airway diseases, including those due to allergies, affect a very significant part of the European population. Indeed, the second wave of the European Health Interview Survey from 2014 informs us that around 17% of Europeans report suffering from allergies, and some 10% report having a respiratory disease, including asthma. We also know that more than 120,000 Europeans die every year from respiratory diseases. And from this, I would like to underline, 50% of all deaths caused by chronic obstructive pulmonary diseases can be attributed to just one source, smoking. So I do not have to convince you, I could quote many other figures, but I do not think I need to convince you that the cost of treating non-communicable diseases is really the lion's share of European health budgets. By most estimates, over 80% of European health budgets go to chronic non-communicable diseases. And also, I do not think I need to persuade you that health promotion and prevention of these diseases are absolutely key, and that we need to do far more in these areas. I think the fact that you are here today is yet another demonstration of the willingness there is and the determination that we all need to come together and work jointly towards common goals. This summit is organized by 6 different but closely related organizations and projects, among them EUFOREA, which is a good practice example of uniting several medical specialties with pharmacists and patients. And we would like to see how we can support and encourage this kind of collaboration across different sectors. I would, however, like to draw your specific attention to 2 important issues which I think we need to pay greater attention to. And these are, first, health inequalities, and also the need to do multi-sectorial work. And I will quote some figures here as well, if you will allow me. Did you know, for example, that some 70% of Bulgarians living under the poverty line suffer from at least one chronic disease, while the European average is 22%, and here in Belgium it is some 15%. So there's a big inequalities issue across Europe. And of course, we know some of the important links. For example, with respect to airway diseases, housing conditions are of importance. People living in a damp or moldy building are 40% more likely to have asthma. So the data is becoming more and more convincing. Socioeconomic status is affecting health as much as risk factors do. We should therefore take into account that people with a lower income will more often be exposed to such additional health risks. And therefore, any action we undertake must have the perspective of reducing health inequalities both within and between member states. I have noticed that, laudably, reducing health and social inequalities is indeed among EUFOREA's objectives. However, and this brings me to my second point, when coming together from various specialities and perspectives within the health sector, although this is indeed in itself very important, the health sector cannot work in isolation. We also need strong allies in all other sectors. This is why it is reassuring that the ECOFIN Council conclusions from November 2016 call, and I quote, for strengthening policies for health promotion and disease prevention to maximize the system's potential to deliver better healthcare outcomes. It's very encouraging to see this language also in that sphere. Also, the report Health at a Glance, Europe 2016, usefully reminds us that ill health impacts on the labor market are very, very significant. About 3/4 of healthy Europeans aged 50 to 59 are employed, while only 50% of their peers suffering from 2 or more chronic diseases have employment. Again, another expression of inequality. We also know that having an airway disease affects a person's participation in the labor market, but there are also reasons for absenteeism and presenteeism. The Health at a Glance report calls for improved policy integration for the benefit of the labour market and for health outcomes. Another important sector where we need more collaboration, in particular with regard to airway diseases, is that of housing and urban development. I would indeed encourage all of you to reach out to the other sectors, whether it be fiscal, employment, urban development, or environmental policy. It is only by joining forces with other sectors that we'll be able to make a difference to the health of European citizens. Indeed, the Council conclusions of December 2011 on the prevention, early diagnosis and treatment of chronic respiratory diseases in children also call for such a multi-sectorial approach. Now, having said that, I would like to share with you very quickly some of our recent actions to tackle non-communicable diseases. Let me start with the most powerful instruments at our disposal, legislation. We are, of course, working full speed to implement the Tobacco Products Directive, which includes some of the most ambitious tobacco control provisions in the world. But looking at chronic non-communicable diseases more generally, we have decided, after much internal and external discussion, not to spend time on developing specific EU strategies or objectives concerning non-communicable diseases, but rather to base our work on the global voluntary targets that member states have agreed to reach out through the UN WHO process. Our role is to support our member states to help them achieve those targets. And we do that by actively supporting member states. And I must say there is a great need for such support, because at the moment the situation does not look very good at all. In fact, it is very likely that most member states will miss out on most of the targets. This is why we need to step up our game. We need to propose a series of actions to member states, and that is what indeed we are doing. We have put in place a member state steering group on promotion and prevention to guide this work, because a political steer is very much needed. And this group will have a strong emphasis on the most important aspect of all, which is implementation. We are very good in Europe at identifying best practices, but we are not so good at systematically implementing those best practices and turning them into standard practices. This is, I think, the challenge. Over the years, through various actions, through the health program, for example, and the work in various expert groups, we have a whole body of advice and recommendations. We now need to move to using such advice, as I said, in a systematic manner. And we need to move from just exchanging best practices to transferring best practices. To support this work, we are putting in place an IT resource center. This center will, among other information, allow for practices to be submitted, evaluated, this is very important, in order to identify what are really the best practices. I'm sure you will have examples of practices at hand which probably fit this description very well. And I'm sure that you would be keen to share this with others and to have it evaluated. I would encourage you, even now, while we're putting this platform in place, to go to the CRODIS platform, our joint action on chronic disease, which allows you already now to enter your practice, and the content will eventually be transferred to our resource center. So it will definitely not be lost, I can assure you of that, on the contrary. I spoke about multi-sectorial work before. Through the new joint action on chronic diseases, which we call CRODIS Plus, we are now reaching out to the employment sector, as CRODIS Plus incorporates the employment of persons with chronic diseases as one of the main horizontal issues. I think this is very, very important. Civil society has the opportunity to contribute to this part of the CRODIS Plus work through what we call a joint statement. That is a statement that will be developed and endorsed by several civil society organizations. This work is led by the European Chronic Disease Alliance, and I would very much invite you to join them in this endeavor and endorse this statement, which should be ready by the end of this year. I would also like to highlight the work the Commission is doing to prepare the midterm review of the digital single market, and we are currently examining how healthcare can be an integral aspect of that. For this purpose, the Commission is currently examining how we can develop further the digital strategy on health, for example, by assessing how technology, as we have seen already examples today, can support seamless patient feedback in developing people-centered health and care systems. E-health creates new possibilities and opportunities to tackle some of Europe's most pressing challenges in the healthcare sector. And we are doing a lot of work on that. A good example are the recently launched 24 European reference networks that will make full use of the latest technology to exchange, among other things, patient information among 900 participating hospital departments from all over Europe. One of these networks centers on rare respiratory diseases, and it's led by the Universitätsklinikum Frankfurt from Germany. E-health technologies, including mobile health applications, in particular applications that patients can use at home, can play an important role in supporting patients in their self-management, which is an essential component of chronic care. Indeed, if I were to summarize what the aim should be, is to move away from hospital-centered model to a patient-centered model. And this is particularly true for chronic non-communicable conditions. It's the only way to achieve this. And the innovative technology, which is increasingly available and cost-effective today, provides new ways of empowering patients. But it needs a framework. It needs to be organized and integrated in a system. E-health technology can allow better self-management of one's disease or conditions, and the patient's platform that you are launching today is a good example of this. We also need to acknowledge and address important issues and obstacles maybe that lie on the way. Trust and security are important when encouraging the use of digital innovation in health. There is also a need for policy actions both at EU and national level to raise awareness about the potential of e-health solutions and to increase trust in these solutions by citizens and other relevant actors. So to conclude, ladies and gentlemen, I would like to thank you once again, and the organizers in particular, for bringing the issue of prevention and self-care in airway diseases onto the table. It really needs to be strongly on the agenda. And I would encourage you, once again, to emphasize the aspect of inequalities in all of your actions. This is a really major issue and one that is unfortunately growing in many respects in Europe. It is the opposite of what Europe should be about. And to do that, we need to work with other sectors and across sectors in a collaborative mode. And let me close by assuring you, really assuring you, that the European Commission will do all it can and is working very hard to support member states to make their health systems more resilient, accessible and efficient in order to better cope with today's challenge of non-communicable diseases. I thank you for your attention, and I certainly look forward to the presentation of the patient support platform. Thank you very much.